We use lasers in this clinic for different reasons. For instance, when a client needs resurfacing because they have age spot or fine wrinkles or acne scar, depending on their need, we have a CO2 carbon dioxide fractionated laser, which is the state-of-the-art technology and the gold standard for skin resurfacing and skin tightening. We use that in mainly Caucasian skin type, means lighter color skin, to tighten and resurface the skin. We also use this laser for individuals with acne scarring or burn scarring, or individuals after motor vehicle accident or any type surgical scarring that resurfaces the skin and makes the skin much smoother and softer, and at the same time tighter. The Fraxel technology now that we have is a combination of erbium and thulium laser, and what it does, it goes into the superficial layers of the skin, and by sending this microthermal layer beam which induces collagen production, tightens the skin and resurfaces the skin. And this is a non-ablative technology. So for individuals that they don't want to have approximately 5 to 6 days downtime, Fraxel is a very safe procedure. It can be used on all skin type and all individuals. It's excellent for reduction of pores, excellent for resurfacing for sun damage, sunspot, for precancer lesion, for melasma, pregnancy mask, for acne and surgical scarring, for stretch mark. It's an excellent laser technology. IPL is another laser technology by use of light that it's used for individuals that they want to have absolutely no downtime. They are suffering from, they don't like their freckles, or they don't like the red spot or small blood vessel on the corners of their nose, or pregnancy mask or other pigmentary problem issue, sun damage, that there is no downtime with this procedure, and it can be done during lunchtime. A very effective procedure. The revolutionary technology in body contouring is CoolSculpting. For the first time, without needle injection or cutting, we can decrease the fat in our body in the areas that we do not want to have these fatty pockets by using CoolSculpting. And the technology behind it is that fat cells are more sensitive to cold than muscle or skin. So by this technology, we can completely destroy the fat cell in the unwanted area and give the body a very nice contour. I have had CoolSculpting on my abdominal area and flank, and I loved it. It was the best procedure ever. We have various form of fillers. We have the temporary one, and longer lasting and permanent. The temporary one, the hyaluronic acid that we started with Restylane, Juvederm, Perlane, Juvederm Ultra Plus, and the recent one, which is Voluma, which lasts up to 2 years, are available in this clinic. And as far as neuromuscular modulator, we have Botox, we have Dysport, and we have Xeomin, which are all effective. We also have biostimulators such as Sculptra, which is polylactic acid, and we have a permanent filler, which is polymethyl methacrylate, which is called Ardefil. They are all FDA approved and very safe for liquid facelift and for use for fillers for loss of volume. When I consult a patient for the use of filler, it depends on what their needs are, the location that the filler will be used, and the duration they want it to last, and how they want to look like. For instance, 18, 20-year-old that wants their lips done, definitely we will use one of the temporary hyaluronic acid. However, when it comes to a 40-year-old or 50, 60-year-old that they want to have a liquid facelift for the entire face volume loss, that they want to look natural, we prefer to combine the hyaluronic acid with one of the collagen stimulator such as Sculptra and Ardefil, and use a combination. Overall, I believe combination of these products work the best. It's like cooking. You cannot just cook with potato or with onion. You have to have variety of different things to cook to make it delicious. And to make a face perfect and reverse the aging, you need different material to use to rebuild and resculpt that face or body for reversing that aging and get that patient to back where she was 15 or 20 years ago, not looking like somebody else.